A herniated disc is not a death sentence. If your orthopedic surgeon wants you to have surgery right away, that's a really bad idea. There's a lot of things that you can do to change that herniated disc because herniated discs are actually malleable. We think about them like they're static, like it's not going to change, but that's not the truth. So what are the top 4 stretches that you can do to actually get improvement from a herniated disc? We're going to go through that in this video. We had a client that came in. He's a 55-year-old. He had an 8mm disc bulge. And we worked with him for about 6 weeks. And then he went and got another MRI, and his 8mm disc bulge went down to a 4mm disc bulge. That wasn't because we did traction or we shot anything into the disc. It was because we just redistributed pressure. And by doing certain stretches and exercises in the way that we move, changing those movement patterns, that allowed his disc to actually go back in because it's malleable. It's dependent on the way that we put stress on that disc, whether it's bulging and where it's bulging and how that pressure happens. The first stretch we're gonna do is a cross body stretch. So I wanna lay down on the table right here. We can do it on our bed. A big focus is I'm not trying to address the disc. I'm not trying to irritate the disc. What I'm trying to do is allow the disc to take some pressure off of it by moving in other areas. So I'm gonna grab this knee and I'm gonna pull it up to my opposite shoulder. Just pulling down, maintaining my chin tuck, and I'm just holding this for 30 seconds. If you can get that glute muscle to engage after 30 seconds, I'm gonna actually push against it for 5 seconds, and then I'm gonna hold it down, do another 30 seconds. But I'm not moving my low back. That's one of the main things. I'm not trying to do a low back stretch. I'm not trying to put pressure on it. And actually putting pressure on your disc is gonna be a problem because going into flexion is gonna cause more irritation, more pressure on the disc. So what I wanna do is just get more mobility through my hip by doing that stretch. I'm gonna do both sides. I'll come down this way, and then I'm gonna pull this knee up to the opposite shoulder without pulling my back up, maintaining that for 30 seconds, push against it, using that glute, and then push back again. So I'm gonna do each one of those. I'm gonna do each side, and then I'm gonna go to stretch number 2. And that's a flat back stretch. So I'm gonna keep my knees bent the whole time, but I'm gonna lay down. I keep my knees bent because if I straighten my legs out, you'll see that my back starts puffing up right there. So I'm going into extension. I wanna keep a flat back position, keep my chin tucked, and I'm gonna come out right here. And I'm pinching my shoulder blades down and back. I'm gonna hold that for about 30 seconds, and then I'm gonna relax right here. I'm gonna do the same thing. So each one of these is gonna be about a minute. I'm gonna squeeze these shoulder blades down and back. By activating these muscles in between my shoulder blades, I'm gonna be able to get more out of the stretch for my chest. We're sitting for long periods of time. We're tilted forward. We're never opening up the front of our chest. We need to open up that area. And by moving in the thoracic spine, we take a lot of pressure off the lumbar spine. Stretch number 3 is going to be a modified world's greatest stretch. Now there's 3 different ways that I want to show you how to do this. So I could get up on this table, and the best way to do it is actually get up here and then drop down, and I'm going to squeeze this back glute. And I'm holding that. Same thing, I'm going to hold this for 30 seconds, and then I'd switch the other way. Now I can isolate it, keep my chest in a neutral position right here, drive into this area, into my groin area right here, and squeeze that back glute. Every time I do this stretch, I'm gonna squeeze the back glute. Hold in that position, 30 seconds, and then I'll go ahead and switch and do the other side. But you can see I'm not doing a bunch of folding in my back. I wanna get this up, get my leg forward, and then drive forward into that groin area, squeezing that back glute. Having my leg up is better a lot of times because you can do it in a standing position, but then you can also do the same thing by getting over here on the side of the table, and I can shift forward. If getting on your knees is an uncomfortable position, then getting down just in this, dropping down into the front of your hips area, and then squeezing that back glute. But the main thing is that I'm not lifting my chest up and trying to do extension with my back. We're looking to take the stress off of our lumbar spine, off of those discs, and redistribute it down into the hips and into the thoracic spine. If we're doing that, we're going to redistribute that stress into areas that can take it on, and then that disc is able to go back in a little bit. Number 4, we're going to do threading the needle. So Threading a needle is kind of an interesting thing. A lot of people do crochet. I don't do it. This is just a great name for the exercise. And what it means is that I'm actually sliding underneath my body. I need to get mobility on the back side of my shoulder blades and the back side of my thoracic spine and my rib cage right here. So what I'm going to do is I'm going to sit back on my hips. If we can put this pressure, I'll show you the variation without putting pressure on your knees, but this one right here is the best way to do it. I'm going to come across like this at a 45-degree angle, put my hand on top of my bottom hand, and then I'm going to just pull over to the side. What I'm not doing is rotating myself all the way over. I want to stay in the middle and actually just push this arm out enough that I stay in the middle and I'm pulling through this area, all through my thoracic spine, my rib cage, my lats, my shoulder blade. I'm loosening that up. So same thing right here. I'm just going to breathe through it for 30 seconds right there. And then I'm going to switch and I'm going to do the other side. We want to make this stuff short, easy, where we can get it done within 5 minutes, loosening up that tissue. That was my breath. So I was talking about breathing, and what's going to happen a lot of times when we're doing these stretches, you have a tendency to hold your breath. We need to make sure that we're breathing and relaxing where you get the most out of the stretch. Now, if I want to do this same thing in a standing position, then I'm going to come right here, and then I'm going to come across, put my hand up, same thing, but I'm standing up, and then I'm pulling over to the side. So when I pull, when I say pull, I'm actually pushing with my top hand. So I'm pushing my top hand and relaxing my head to come over, and I'm pushing back into this back hip. So this chain from my arm all the way to the back of my hip, I want to loosen that up because we're looking to loosen chains of tissue, relaxing that head down. And I'm doing it for 30 seconds. I'm going to do the same thing, just getting out right here, dropping down, I'm dropping that back hip. If I'm way forward like this, I'm putting a lot of pressure on my back. I want to be back on my heels when I do the stretch, leaning into it and pulling over. We don't want to put extra stress on our back when we're doing these things. We're decreasing stress on our lumbar spine where the discs are bulging, and we're redistributing that. We get more movement through the thoracic spine. We also get more movement through the hips, and that's going to allow that malleable disc to be able to actually go back in and decrease some of that stress. It's not going to go back to the normal system that it was before. It's not going to be the perfect disc at any point, but it can go back in. It is malleable, it is changeable, and it's something that you should take the bull by the horns and actually start changing the movements that are happening above and below that disc, and you're able to get the improvement that you're looking for, because a lot of times the disc isn't the end-all be-all. It's not the thing that's causing the pain. We need to figure out how we can get that mobility so we can take stress off of it. The reason why this is successful is because when we look at the spine, we've got the cervical spine, the thoracic spine, and the lumbar spine. When somebody has a bulging disc in the lumbar spine, they have a really stable segment here in the thoracic spine, and they have a really stable segment here in the hips. There's a lot going on right here. There's a lot going on right here, but this is exposed. And most people have problems with bulging discs because of areas that are exposed that they don't have enough stability around them. The fastest way to get results for you is to make those areas that do have a lot of stuff going on, those stiff areas, to loosen up this other stiff area and take that stress off the lumbar spine. And then we have to turn it into a routine. So if you can get into this routine of less than 5 minutes a day, and you try to do it, best case scenario, you do it twice a day, but make sure that you're getting that mobility through this area, mobility through this area, and these stretches really attack that. Check out our other videos on sciatica, low back pain. We'll see you in the next video. Get mobile and stay active.